Hi, my name is Katie Knope, and my action research project was focused on increasing the phonological awareness skills in preschool-age children. Phonological awareness skills are defined by the ability to hear, manipulate, and isolate sounds in spoken words. The focus is solely on oral language and does not involve print or text or matching sounds to letters, things like that. They begin to develop in the preschool years, and there's three distinct levels of manipulation. So the ability to manipulate syllables, rhymes, and then the phoneme level or single sound level awareness. Components of phonological awareness skills include familiarity with general sounds, rhyming, ability to identify and match sounds, syllabication, blending, and segmenting. Phonological awareness is a really important skill as it is a high predictor of later reading development. Children need multiple opportunities to engage in, respond to, and practice phonological awareness skills. That's really highly important so they learn how to distinguish sounds, manipulate sounds, and later use sounds as they learn how to read. There are a variety of risk factors that might impact a child's phonological awareness development. Some of those are environmental factors such as gender, socioeconomic status, parent education, and parent perception. So parents' ideas of if this is an important skill or not. Within child factors, there are also some within child factors that have been determined, and those are lower social skills, as well as reduced expressive and receptive language development. So there's been a variety of research regarding specifically preschool children and their ability to develop and maintain phonological awareness skills. A lot of that instruction has occurred in small groups focused on providing very specific interventions. They're often multimodal, so sometimes they'll use musical interventions or movement interventions in association with the specific phonological awareness tasks. And then also just increasing teacher knowledge. So some of the interventions have focused on increasing teacher instruction in order to increase the skills of young children. So as far as my action research plan, what I just went through was kind of the previous information and history, and now I'll start talking about what I specifically did for my action research plan. So my APR question was, do the phonological awareness skills of young children increase when a daily phonological awareness activity or lesson is included into the routine? So providing a large group, direct instruction type of activity and determining if that yields any significant change in early phonological awareness skills. That was my hypothesis. So the timeline, this was a 6-week intervention. The first week was focusing on gaining the pre-assessment data. Weeks 2, 3, and 4 were where I provided the actual intervention. Week 5 is where I obtained post-assessment data, and then week 6 was data analysis. So in order to collect information about a child's pre-existing phonological awareness skills, I used what's called as the Phonological Awareness and Literacy Screener, otherwise known as the PALS. It's a screener that looks at a variety of areas of early literacy and phonological awareness in young children. However, the two areas of the assessment that I focused on were beginning sound awareness and rhyme awareness. So the PALS is actually a screener that the school district that I work for uses for all 4K children. We administer it in the fall and then also in the springtime. So I use the fall benchmark as my baseline. The PALS is an individual assessment, so each child was assessed in a one-on-one setting, and they can take as much time as they want. The beginning sound uses pictures, and the children have to match the pictures that begin with the same of words that begin with the same sound. And then the rhyme awareness also uses a booklet of pictures, and the children are asked to match a specific rhyming word to a group of 3 different words and find the one that rhymes. Here's my pre-assessment data. So I had 13 students in all, and on the beginning sound, you'll note that a few of them obtained the highest score, so a 10 out of 10 on both the beginning sounds and the rhyme awareness is the max that a child can get. So a few of them came in already with some really nice skills, but some of them definitely had some room for improvement in both the beginning sounds and the rhyme awareness. So based on my data, I decided to really focus on teaching those foundational phonological awareness skills. So the intervention occurred every day in a large group setting. After the students had done free choice time, they would clean up, come to the carpet area, and we would engage in what we called a listening game. That's just kind of the name that we came up with it together. And the kids really liked that and would really cue into time to do their listening game. So week 1 really focused on listening to sounds and words in our environment. So some of the intervention games and activities that we did was I had all the children close their eyes, and I chose one child to go to a different part of the room and make a sound, like say moo or a different sound, and then the children with their eyes closed had to isolate that sound in the location, so they would point to where they thought that they heard that sound. I also did activities such as same sound, different sound. So I would say 2 sounds, and I started with environmental or familiar sounds, like I would say moo, moo, and then ask the children to hold up a green card if it was the same, or a red card if it was different. And then I moved on to words like fan, van. And then I moved on to letter sounds like ah, ah. Week 2 really focused on isolating and identifying the beginning sounds in words. So I used a lot of picture cues for this, and we matched words that sounded the same at the beginning. So ball and bat and man and mouse. Week 3 was focused on introducing some of those rhyming words. And again, I used some picture cues, and we focused on different rhyme families. So I typically chose just 2 to 3 rhyme families at a time, just to reduce the confusion. And so we would match the words that rhyme together. After intervention, I again administered the PALS assessment. Like I said, it's typically administered in the fall and the spring, but in order to really see if there was any growth across the 3 weeks, I administered it again. Here's just a quick little synopsis of the scores that were obtained. And then this graph kind of shows it a little bit better. You can see the first column is the baseline. The second column is the post-assessment data. So any numbers highlighted in pink indicated that the child had obtained the maximum score from the beginning at baseline, and they maintained that score. Numbers highlighted in green indicates growth, and numbers highlighted in yellow indicated that the score stayed the same. So in the area of beginning sounds, all children either maintained their highest score or increased their score, or one student remained the same. No students showed any regression in skills. For the rhyme awareness, there was a much smaller amount of growth, but still many of the children, just slightly over half of the children, demonstrated growth, while the rest of the children stayed the same, and only one child went backwards and indicated a regression. And it should be noted that it's probably not necessarily a regression or a loss of skills, but rather the student probably guessed on a lot of the tasks during pre-assessment. and then possibly guessed again during post-assessment and just didn't get those guesses quite right, because it would be fairly easy to make some educated guesses on these assessments. Next, you'll see just the visual representation. So you'll see that the blue line is the pre-assessment for beginning sounds, and the orangish yellow line is the post-assessment. So you'll see that there was definitely some growth, a little bit more for some students than for others. Same with the rhyme awareness. Pre-assessment is outlined in blue, and post-assessment is outlined in yellow. So a little bit smaller amount of growth, but still definitely some growth. So the research findings indicate that in the area of beginning sound awareness, 6 of 13 students obtained and maintained the highest score. So they achieved a 10 out of 10 right from pre-assessment and were able to maintain that score through post-assessment. 6 of 13 demonstrated growth, so meaning that they increased their scores from pre-assessment to post-assessment, and just 1 of the students remained the same. So they didn't necessarily have a higher score, but they also didn't have a lower score. In the area of rhyme awareness, 7 of the 13 students demonstrated growth, so they increased their scores. 5 of 13 demonstrated no change, and 1 of the 13 demonstrated a decrease in scores. And I wouldn't necessarily call it a regression or a loss of skills, because on this assessment, as with many assessments, children can guess an answer. And so for this particular child and maybe some of the other children during pre-assessment, their scores might have been slightly higher than their actual skill level, just due to their ability to make a correct guess. So just some general conclusions. It is known that phonological awareness skills are an indicator of later reading development. That is proven through a variety of research. And then just based on this research project, it would appear as if direct daily instruction in phonological awareness activities may increase a child's overall skill. Some significance of the findings as it relates to my teaching practice and teaching the students in my classroom. It would appear that increasing explicit instruction can increase overall skills. Even though this was a very short project, we only had 3 weeks of intervention time, I definitely, based on the assessment data and also just based on my general observations, noticed an increase, in children's willingness to participate in these types of activities, B, in their confidence level in trying to answer and participate, and C, just in their general knowledge and skill. For our class, we're going to continue to implement our listening games into our everyday routine. So we have, even though the intervention has technically stopped, we have continued to, for about 10 to 15 minutes every day, continue to do a phonological awareness activity or task. And then my hope is that on their spring PALs, when we re-administer it, I'll be able to track some really nice year-end progress and show some growth in this area. Future studies. So in order to determine if this truly was a successful project and a successful hypothesis, one would need to expand upon the study and complete future studies that are similar. A few suggestions that I have would be to expand upon the length of the intervention. Like I said, 3 weeks is a very short window of time, especially when you're providing instruction to young children. And so I would suggest a minimum of like an 8 to 12 week time frame to really see what the difference is. I would also target additional sub-skills of phonological awareness. So in addition to beginning sounds and rhymes, I would do different activities that focus on segmenting, blending words, breaking apart syllables and syllabication, things like that. The reason I focused solely on rhyme and beginning sounds is because I knew we only had a short amount of time, and it was just too much to provide intervention for and too much to measure if I focused on all aspects of phonological awareness. And so that's why I for this time focus just on a small sector of it. However, for future studies, I would expand that. And then I would also expand the study size. So I have 13 4K children in my classroom whom I did this project with, but in order to really get a true, valid, and reliable project, you should probably have more students. And also, it wouldn't be a bad idea to have a control group, so a group of students who maybe aren't receiving the direct, everyday whole group instruction in phonological awareness, just so you have some comparison. Those would be my suggestions for future study. And that concludes my presentation. The following are just my reference pages. But if you have any questions about my study or the interventions that we did or anything in regards to the effects, please don't hesitate to ask me. I would love to answer any questions or provide any direction that I can. All right, thank you for your time.